Hello, I'm Peter Allcroft. I'm a palliative care doctor down at Flinders Medical Centre and I work in Southern Adelaide Palliative Services.
Hello, I'm Kathryn, Hourigan, a consumer advocate. Together, Peter and I co-lead the Statewide Palliative Care Clinical Network of the CEIH. We're here to talk about palliative care, and I have a question for you. My specialist has told me that there is nothing more that can be done. My friends say that I need palliative care. I don't know where to go, and I'm very scared.
The word palliative care is scary. What we try to do as a service would be to smooth out those speed humps, to try to foresee into the future what the problems might be and make that journey for patients and family as smooth as possible. Palliative care is a place of safety, of encircling, of embracing patients and families with part of our multidisciplinary team, with our doctors, with our nurses, with our art therapists, social workers and music therapy. The other important person that we really engage with is our general practitioners. And that would be the first point of call that I would always recommend a patient and their family. If they're frightened, where do I go for information? To touch base with their GP, but also Palliative Care Australia does have on their website information portals, as do all the state-based health services have information of where a local palliative care service might be in the metropolitan or the rural region.
Peter, if you had to list the most terrifying concerns or fears of someone facing their death, what would they be?
I think the things that people fear most is often poor symptom control. And what we try to do with palliative care is to focus on quality of life and not just the disease. Some of the things that people fear also would be their not being with their loved ones when they're dying. And unfortunately, we've seen that in the last 2.5 years with COVID, where people have died alone. And people fear losing their dignity and their respect. So I think those would be the big three that people would worry about: their symptoms, their loved ones, being unburdened, but unburdening their loved ones, and losing their dignity is their greatest fear.
So Peter, what would a good death look like?
A good death to an individual, I think, would be being able to maintain their dignity to the end, to being in a place of their choice, and that could be a hospice or it could be their home or their aged care facility, to having their loved ones with them. I think a good death also is important, having clinicians, nurses, doctors that you have faith and trust in, but also having good symptom control to the end. That might be pain, that might be breathlessness, but being with your family, having your dignity for as long as possible, they're the important things that make a good death.
Thank you, Peter, for helping us raise awareness of palliative care in South Australia. This is part of our vision as the co-leads of the Statewide Palliative Care Clinical Network, to have the vision of what would be the best possible patient experience of palliative care.